You'll see that as a CRNA, and I've been doing anesthesia for the last 30 years, and I've been involved with some type of suggestive therapy prior to anesthesia probably for about 25 of those 30 years. I'm going to share some of those things with you today. Now, being a nurse anesthetist, one of the things I'm used to is when I take a patient in, they fall asleep. I figure if they fall asleep, I've done my job. If they wake up, I expect to get paid. Went into hypnosis, and guess what? You still ask people to close their eyes. So it's the same thing. We'll do a little bit of that today, too. All right. Anybody here ever had surgery? Wow, so you already know what you're doing and what you're thinking, correct? Makes a big difference in what your outcome is. How many of you are actually working with clients or patients coming to you before they have surgery? Super. Well, maybe today we'll give you a couple little extra things to work with. Any medical type people in here today? Ooh, this is a good class. All right. So we're going to do really well here. Okay, as you can see, unfortunately, Mrs. Kellerman, we're all out of Novocaine. However, we do have Mr. Sedato, master hypnotist, coming in. And sometimes, guess what? When you're working with hospital staff, that's kind of how they see you. I can remember when I first got started, and of course, I let it be known I went and took a hypnotherapy course. So guess what happens when I'm walking down the hall? Doctors see me, don't look at me. And it's not changed a whole lot since then. So we still deal with it, and I deal with it. I've been dealing with it in the military since 1985. That's doing anesthesia there now. I've dealt with it all over the world since I've been on a lot of ships where we've used hypnosis. As a matter of fact, I got an email not too long ago from one of my past students who was stationed on one of the what we call gator freighters, amphibious ships. And when he was getting ready to leave, the commanding officer of that ship specifically said they wanted somebody who had hypnosis experience to take his place. That's how much they utilized him. He did like 380 hypnotic interventions while he was on the ship. Now, unfortunately, most of that was with the CO and the XO, and some of these people, they're in very high-stress situations. I've been on 6 different ships, including a hospital ship myself, and I think that's where I probably ended up getting the biggest of experience in hypnosis, because we didn't have a psychologist. We had the chaplain and we had the senior medical officer. I became the psychologist as the ship's nurse, and anytime they had any problems, they sent them to me, especially for stress, phobias, so we didn't have to send them off the ship. What we're going to talk to you today is kind of getting into that boat of you helping people go through surgery, some of the things you can do to get them into the hospital setting. Some of the things that we do if we say the right thing up in advance. You don't know where your people are going to be having surgery, right? But why do we want to use hypnosis? Well, first of all, we know it's a mind-body therapy. Anybody here who has read Candace Pert understand very quickly that if we get down to the molecular cell memory, that all cells talk to each other, and so we've got the mind and the body. And those of you who've learned all your life, the subconscious mind's what? Right up here. I call it the autonomic nervous system. Now the research, biophysical research, are finding out is your subconscious mind is your entire body, because you've got these polypeptides everywhere that pick up all these wonderful suggestions and actually respond on them and speak to each other in chemical language. And your body, if you know, has got like 6,000 different chemicals in it, so therefore they do a lot of talking. We know we can change the stress response. Those of you who've taken other courses, such as the hypnobirthing course, and some of those realize the difference that stress makes when it's throwing out catecholamines and how your body responds. We can improve healing. This is evidence-based. There's a lot of empirical data, so we don't have to go in with a lot of anecdotal information saying, yeah, this works. Well, show me your data. We'll talk about